So another additional research design under quantitative research design are the following. So we have methodological studies, we have secondary data analysis, we have evaluation studies, we have also meta-analysis, outcome research, and operational research. So we will discuss it shortly. So methodological studies, this is conducted to develop, validate, test, and evaluate the research instrument and methods. So methodological study can be done, for example, in pressure sore risk assessment. So we have risk assessment tools, can be specific to pressure sore of specific patients like in orthopedic wards. You can review if the tool is effective or not. Okay, that can be done. We can apply it in pharmacy practice, for example, in our adverse drug reaction monitoring. There is a form, there is a tool, or we can also have self-medication tool. So you can check if it's effective or it needs to be validated more. So these are the steps of methodological studies. So there is still specific and scientific step to perform in order to arrive with an answer if it's reliable or a valid tool for research. The second type is the meta-analysis. So meta-analysis is a statistical procedure where we can analyze a lot of quantitative research output and create or conclude or make a single generalization out from it. Okay, so this is a highly technical type of research study. So it is commonly called a systematic review and meta-analysis, where, for example, you will begin with 1,000 quantitative research design, and you will tailor it down according to your criteria. You will just identify which among these 1,000 quantitative design are true experimental. So from the 1,000, it will be down to 500. So from that 500, you will now apply your keywords. So for example, adverse drug reaction. So out from that 500, only 250 has this adverse drug reaction topics. And then you will tailor it down specifically according to your keywords, and then you will be down with sound journal articles, maybe 10 to 15, and then from that, you will analyze, compare the 15 results, and do meta-analysis applying statistical software. Okay, so this is highly technical type of research design. Steps in conducting meta-analysis. So define hypotheses, locate studies, input data, calculate effect sizes, and analyze variables. Another type of quantitative design which can be done in our setting is the secondary data analysis, or what we call as the systematic review. You can analyze previously published or unpublished research articles and generate new hypotheses from it or generate conclusions from it to help address some problems in that specific topic. So secondary data analysis can perform with both quantitative and qualitative data. So you can perform quantitative systematic review and conduct meta-analysis later on, or you can do systematic qualitative review and conduct meta-synthesis later on. But you can do systematic review for both quantitative and qualitative data. The next one is the outcome research. So it is planned to assess or record the end result of healthcare services. So you will evaluate the outcome. So commonly it is used in nursing or in clinical pharmacy to develop evidence-based practice and improve the pharmacotherapy of our treatment. So outcome research evaluates outcome and the impact to our population of choice. And the next one, we have also evaluation studies. Under it, we have formative evaluation and summative evaluation. So these evaluation studies determine effectiveness or value of processes, programs, policies, personnel, equipment, and the material used in particular setting. So these evaluation studies will of course evaluate the performance, okay, performance of the process, the personnel, or the equipment, if it can deliver the purpose it's stated. The next one is the operational research. So it involves study of complex human organizations and services to develop new knowledge about institution, about programs, use of facilities, and personnel. So you can do operational research if you are attached with the institution or if your advisor is the dean or some other administrative personnel, so that you have access to to review the operation that is employed in the certain institution or facility. Okay, so you want to improve the efficiency of their workflow, uplift the services that they are rendering to the stakeholders.